Welcome to Rhythm Yoga Therapy, where we teach that rhythm is healing and yoga helps restore our rhythm. A tool that really helps elevate us as yoga therapists and yoga professionals is a simple communication tool that's used in the healthcare system worldwide called the case presentation or the case conceptualization. This is a tool that I learned when I was in grad school, and it really helped me not only talk to colleagues about the cases that I was working on, but it also helped me understand what was going on with my clients or patients, just depending on what setting you're in. So when we learn this tool, it really empowers us as yoga therapists and yoga professionals to take our game to the next level and speak a common language that the healthcare system uses, both medical and mental health and behavioral health. So when I teach this to my students, sometimes they feel a little intimidated when they first hear about it. It sounds so formal, it sounds so like big deal, but actually it's really an informal conversation, a back and forth between you and your colleagues to help you understand your cases better. And a lot of times we have a question about, well, what should I do if my client is looking anxious but talks about this, or is feeling depressed and I don't know how to help them motivate? And so this tool can be really useful once we understand it's just a conversation with a little bit of organization. So what follows is a case presentation by my colleague Ashley. And it's just a really great example of how we can be empowered to learn new skills.
She had first been diagnosed with anxiety and ADHD when she was in third grade, which got worse in fourth grade and kind of morphed into a little bit of separation anxiety from mom specifically. But then during the pandemic, she started having panic attacks, mostly where she would get like angry and tearful, and a little bit aggressive, like not super aggressive. And then in October of this year, she started refusing to go to school, specifically saying it was because she didn't want to be away from mom, but then there was also some social anxiety going on with some things at school because she moved this summer from Texas to Colorado. So it's a new school as well. I've done more breathing practices, and specifically the like slowing the exhale down because she has like this nervous energy and you just kind of feel it from her, and a little bit of the ADHD still there. We've been going from like fast to slow with some of the breathing practices with the Satanama specifically, to try to help regulate her a little bit. And she seems to like that. And then we also the one yoga thing we have done is the legs up the wall. Once she's kind of come down a little bit, and I had given that to her as homework, to like incorporate that into her like wind down bedtime routine. And she actually has been doing it fairly consistently, like she says about 3 times a week, and she reports really liking that. So I was happy with that specifically. I think sun salutations would be really helpful as well for her, because she does have the unspecified depression, but it's not like super apparent. I think that would be pretty regulating for her. And then I also had this thought of using like the cat cows into the wave sequence, and that might be helpful for her as well. So
yeah, so I'm thinking, yeah, that's why I asked is, so what you were saying about starting with sun salutations, I think that's actually a really good idea, because again, if she is moving and needing to move all the time, then you got to meet her where she's at, and doing a sun salutation will be, will start up high, in terms of the energy, and then you can slow it down, because again, it's like what Michelle said all along, is you got to meet them where they're at. And in the red body, she's more active.
Yeah, and in fact, you could take what you've already done and almost like flip it on its head, where you could start with the sun salutation and then do the little bit that Emily had talked about. We called that a vinyasa, a flow. And then you could do the breathing. You could have her either sit or stand and do that breathing where she lengthens the exhale. In fact, you could even do it in the movement. You could, because it's at her age to have that concrete, if you inhale and then exhale. And so it could be even at first, but then 3 in, you could be like, maybe she inhales up on a count of 5 and then exhale 7, 6, 5, 4, 3, 2, 1. So you could end up exhaling, so she really gets what you're talking about with that extending the exhale for her brain, just where it's at. So
Yeah.
yeah.
Okay.